Thank you. Thank you. Thank you so much. And thank you all for being here this morning. I'm very pleased and very excited to be here this morning to launch the Long-Term Care Home Finder, which is a much needed new website that will help seniors and their families get the information they need to make informed decisions about long-term care. Our government has a plan to fix long-term care and to ensure Ontario seniors get the quality of care and quality of life they need and deserve both now and in the future. We've heard from prospective residents and their families that finding information and applying to homes can be very frustrating, and I certainly agree. In our own family experience recently, we went through the very same thing, trying to find homes, trying to find information on homes, and it's information that is available, but it took a lot of searching to get to the point that this new website will get us at today. The information, as I said, was spread out over so many different websites, was so hard to find. This new website and the search tools puts that information and the information that families need at their fingertips. A key feature of the website is the home search and map tool. Using the tool, you can look up long-term care homes in any part of the province by name, city, or postal code. You can look at the detailed information on the home, including wait times, staff vaccination rates, and inspection reports. And this is just the first phase of the website's rollout. Future phases will have more features based on user feedback. As the website evolves, it will also include more information about each home. When all the information is in place, the Long-Term Care Home Finder will be a valuable resource for anyone looking for information about Ontario's long-term care system. You can visit and explore the site already at ontario.ca/long-term care. This website is part of our government's plan to fix long-term care. And as I've mentioned on many occasions, the plan is built on three pillars: staffing and care, accountability, enforcement and transparency, and building modern, safe, comfortable homes for our seniors. This website will improve transparency by putting information about all the long-term care homes across the province in one easy to access place. To strengthen this pillar, we are also investing $72 million over 3 years to more than double the amount of inspectors in Ontario. This will make Ontario's inspector to home ratio the best in Canada. And in this year's fall economic statement, we committed $22 million to implement Ontario's Ontario-made technology that will integrate health data and information between hospitals and the long-term care sector. This will streamline readmissions and share information with families. Of course, strengthening enforcement, accountability, and transparency is just one pillar of our plan to fix long-term care. Equally important are the other two pillars: building modern, safe, comfortable homes for our seniors and improving staffing and care. We've made major strides in all of these areas as well. Our government has committed $6.4 billion to building the residents and homes that residents deserve. It's an unprecedented commitment to long-term care, with over 30,000 new beds and 28,000 upgraded long-term care beds across the province. With over 21,000 new and 17,000 upgraded beds already in the development pipeline, we are making great progress. And we've committed $5 billion over 4 years to improve staffing and reach our goal of providing an average 4 hours of direct care per resident per day. This investment will create more than 27,000 new positions for PSWs, registered nurses, and registered practical nurses in long-term care. And as I was reminded yesterday, when we were in Ajax announcing the completion of a new 320 bed facility, a quick build. A building is a building, but it's not a home until the people that work in it, the PSWs, the nurses, the staff, that's what makes a building a home. And I was reminded by a friend of that yesterday, and I didn't want to forget that today. Through these actions, we are fixing long-term care. Through these actions, we're helping ensure that every resident experiences the best quality of life supported by safe, high-quality care. Again, you can try out the long-term care home finder today at ontario.ca/long-term care. And with that, I would like to pass this over to Minister Rasheed.
Thank you so much, Minister Calandra, and good morning, everyone. I'm proud to join my colleague, Minister Calandra, today to introduce the long-term care home website, which was developed in-house by my talented team at the Ontario Digital Service alongside the Ministry of Long-Term Care. Together, we are building an Ontario that puts people first by making it easier for prospective residents and their families to find information on long-term care homes in Ontario. This resource is something that Ontarians expect and deserve, and we are making it happen. Ontario families and stakeholders told us they need better access to long-term care information to meet the needs of Ontario families by developing this long-term care home tool. Today marks another important step our government is taking to build an Ontario that puts people first by providing an easier, more transparent way to get information on every single long-term care home across this province. This user-friendly website will go a long way towards providing prospective residents, their families, with the information and comfort they need to make life-changing decisions. By providing the people of Ontario with the information they need at their fingertips, our government is making it easier for families to make the best decision possible for their loved ones. The long-term care home website was rolled out initially in December, where our government provided a secure and trusted way to access long-term care information all in one place. The new website features a home search and map tool, plus individual home profiles offering details about all homes and how to apply. Home profiles include helpful information such as the size and services of the home, administrative details, and wait times. Over the coming months, we will continue to improve this site as we conduct user research with people and families in Ontario. The long-term care home website, which can be found at ontario.ca/long-term care, is a one-stop resource for anyone who is looking for information on Ontario's long-term care homes. I would like to thank the families and the stakeholders who took the time to share feedback with us to build this resource. We will continue to listen to their input as we roll out new features. I would like to thank my team at the Ontario Digital Service and the team at Ministry of Long-Term Care for their support to build this important tool. Thank you, and now we have a video to share with you all.
The Ontario government has launched the Long-Term Care Home Finder at ontario.ca/long-term care. You can use this tool to search for long-term care homes by postal code or city and find the homes that work best for you. Learn about features of different homes, including number of beds, waiting lists, staff vaccination rates, inspection reports, and more. The Long-Term Care Home Finder will help Ontarians considering long-term care make an informed choice. It will help them to apply, and it will provide resources for anyone who wants to know more about Ontario's long-term care homes. Explore the Long-Term Care Home Finder today at ontario.ca/long-term care.
Awesome. Thank you very much, and again, just thank you, Minister Rasheed, and the great team at Digital Government for putting together what I think will be what is a great site, and will certainly be a game changer for many families as they progress on their journey through long-term care. I think with that, we can take questions if there are any.
So we'll open it up now to the media for questions. If you are a member of the media and wish to ask a question, please use the embedded raise hand function located at the bottom of your screen. Before asking your question, please introduce yourself as well as your outlet. Just a reminder, it is one question and one follow-up. First question goes to Richard Southern.
Hello, Minister. Richard here from City News 680. How are you doing today?
I'm good. How are you, Richard?
I'm good. Nice to talk to you. I know a number of families who have lost loved ones in long-term care. They say they lament the fact that there's no independent oversight officer to go to. Do you, sir, support the creation of a long-term care ombudsman? And if not, why not?
Look, we have brought forward a very comprehensive plan, as I said in my remarks, with respect to improving the quality of care. And it's not just about building new buildings and the massive amount of increase in the staffing. It's also about the inspectors. We're doubling the amount of inspectors across the province of Ontario. As I said, we have the largest ratio of inspector to home ratio. Our inspectors we want to work with the home so that we can improve the quality of care. I think this website in itself will offer a wonderful new avenue for transparency as well. We'll have inspection reports on each of the homes downloaded for people to look at right at their fingertips, the work that the family councils are doing. So we are doing a lot of work to ensure that families have and the residents have the best quality of care possible and the maximum level of transparency.
Minister, for my follow-up, I'd like to ask you a question in your capacity as government House Leader. It's exactly 4 months until the provincial election takes place. If you average all the polls we've seen so far, it points towards a very possible Conservative minority government. And the opposition leaders have already indicated that they might join forces. They will join forces under that scenario. I'm wondering, sir, 4 months out, what you think about the real possibility of a Liberal NDP coalition government come June 2nd?
Look, Richard, we've got a lot of work to do between now and an election. We have a very busy legislative schedule in the coming months and a budget. So I'm going to be focused on that, focused on the work that we're doing here in long-term care. I know the others are out campaigning already, but we're focused on governing the province of Ontario, and we'll let the people decide what happens when the election is called.
The next question goes to Lorenda Redicott.
Hi, Minister. It's Lorenda Redicott with CBC News. Many homes are in outbreak. Families are talking about how their loved ones have been experiencing weeks in isolation. They've been shut in their rooms. That's as many of them, they have 2 doses, 3 doses. Sometimes they even have 4 doses of the vaccine, and they've also continued to test negative. So why is that still the policy? And is there something else you're looking at doing?
Well, look, as we've always done, we're going to work closely with the Chief Medical Officer of Health to ensure that our homes, first and foremost, and the residents are safe. You're right, we have done remarkably well with 3rd doses. I believe upwards of 90% of our residents have at least 3 doses. Close to 80% of the staff also have 3 doses, and we know it has been challenging. Omicron has certainly posed a lot of challenges. Having said that, I am in the process right now of reviewing the policy with respect to visitors and homes, and I think over the next day or 2 I'll have a bit more to say on that.
And as a follow-up, we've heard from a number of people about the staffing crisis, and the staffing numbers, they're really not equal across all the different homes. Why haven't you done anything to urgently bring in extra staff at this time?
Yeah, we've obviously been closely monitoring staffing at all of the homes across the province. We work very closely with the local public health units and directly with the homes themselves. Frankly, we're seeing over the last number of days a very positive trend in terms of staff cases of COVID have certainly been on the decline, but we're watching it very closely, and we're always prepared to assist homes when it's required. But right now we're in a stable pattern. It's in no small part to the fact that upwards of 80% of the staff have 3 doses. It's because we put 3 doses for our residents. So we're in a stable position now, but we're of course going to continue to monitor this going forward.
Next question goes to Holly Mackenzie-Suter.
Hi, I'm with Canadian Press. I wanted to ask about this new website. Is there going to be information about outbreaks, like active and past COVID outbreaks and deaths in the individual homes? And if there isn't, could you say why not?
Yeah, we are going to continue to populate the site over the next little while. It will include, obviously, going forward, the resident survey that we are in the process of developing and launching a little bit later on this year. So our goal really is to download as much information as possible on the homes. That's why we'll have the inspection reports as part of that. It will also feature the new builds, where the new builds are happening across the province of Ontario. So this is a major step forward in transparency, and the more that we can get on this site, it is our commitment to do that. I know Minister Rasheed and the digital government team have done a remarkable job of making it an easy site to use, easy to access the information. And you're right, the more information we can get onto the site, the more valuable that will be to the people who are using it, and frankly to the families and the residents, and helping inform the decision that they'll be making.
Thanks. So just so I understand, you're saying yes, that there will be death and outbreak information on the website. And I do have one other question as well.
Look, we're starting the website right now as launched. Is going to be a vibrant site. It will increase, and it will have other information that will be downloaded to the site as time goes on. We want to get it out there. So right now you'll see things like the inspection reports, which homes are in outbreaks, how much of the staff have their 3rd doses, how much of the residents have 3rd doses. But the goal of the site over the next phases of it is to add all of the information that we have available and make that available to the residents and to the families as they make to help them inform the decisions that they're making for their loved ones.
Thanks. And I wanted to ask as well about pushing back the deadline for 3rd doses. I mean, that came at a time when we're having a lot of people dying almost every day in long-term care homes, and it does seem like there was some urgency to the policy. So I'm just wondering kind of if you could elaborate on why you chose to push the deadline back by a couple months. And I also just wanted to comment on the fact that the homes can actually give unlimited extensions to people getting the boosters, and they don't have to request, the government doesn't have to approve those extensions at all. So I'm just kind of wondering how confident you are that this policy is going to be effective at getting the boost rate up if people can just give extensions kind of indefinitely.
Yeah, look, we are close to 80% of staff, of those who work in long-term care homes, who have their boosters. So I think that is an incredible progress in helping keep our residents safe. And over 90% of the residents have 3rd doses and proceeding towards their 4th doses. So we are in a very good spot. Having said that, there was some staffing challenges that we were facing to ensure that the homes had the appropriate levels of staffing that they needed. We have delayed to March 14th the requirement for the 3rd dose. We think we work very closely with stakeholders in the sector just to ensure that this was a reasonable timeline to do it. But look, I'm very confident. As I said, we have 80% of staff that have received full vaccination and a booster, and over 90% of the residents. So we're progressing in a very good way on this, and I'm very confident that by the time we get to March 14th, we will see those numbers very reflective of the broader population as well.
The next question goes to Andy Takaji.
Hi, Minister. This is Andy Takagi with the Queen's Park Briefing. So you mentioned that you've had staffing challenges around long-term care homes. A Main Street poll from yesterday found that 2/3 of Ontarians want military help in long-term care homes, like what happened in 2020. And when they were called in 2020, it was a little bit of a delayed response, and there were deaths because of that. Is this under consideration now, and why or why not?
Well, look, to be clear, as I said, 80% of the staff have full vaccination and a booster. We are working very closely with the homes directly to ensure that there is the appropriate level of staffing in those homes. And one of the reasons why we delayed the mandate to March 14th for the staffing to have their full vaccination and booster was to ensure that we did have that complementing of staffing. So the homes are reporting back. They're in a good spot right now, and we're very confident that that will continue going forward. And by and large, we're seeing that staffing levels have remained consistent, and the amount of staff that have been impacted by COVID has started to come down in a very favorable way. So we're very confident that, and the homes themselves are confident that they can handle what is before them right now.
And just as a follow-up, opposition critics and LTC advocates are concerned that you won't be the full-time LTC minister given your other duties as House Leader. How do you intend to balance those two duties? And do you see yourself as a caretaker before another minister is appointed, or is this your permanent role?
Look, I always serve at the pleasure of the Premier, first and foremost. I'll say, look, I was one of the only House leaders not to have other responsibilities in Ontario. Frankly, this is a role that I'm very, very excited to have. I want to accomplish good things in this. The government has put so much emphasis on fixing long-term care. Look, when we came into office in 2018, it was clear that investments had to be made in long-term care. The Premier made it a focus of our government. We knew it was unacceptable that the previous Liberal government had invested in only 611 beds in the previous two Liberal administrations. So look, when you look about the new builds that we're doing, when you look at the investments that we're making to get to 4 hours of care per resident per day, the thousands of PSWs, the nurses that we're bringing on, those are the lifeblood of any home. We are moving forward to fix long-term care in the province of Ontario for the people, for the residents of those homes. And it is something that I'm very excited to do. I also cherish being the government House Leader, and I look forward to the session ahead so that we can continue the good work, not only in long-term care, but across government.
There being no further questions, this concludes the Q&A portion of this announcement.
Thank you very much, everybody. Appreciate it.